Gentleman from Massachusetts is recognized.
Thank you, Madam Speaker, and I want to thank the gentlewoman from North Carolina, Ms. Fox, for the customary 30 minutes. I ask unanimous consent to revise and extend my remarks, and I yield myself such time as I may consume.
Without objection.
Madam Speaker, I rise in very strong opposition to this closed rule, which provides for consideration of S-764 legislation to create, in my view, inadequate GMO labeling requirements, and S-304, yet another Republican attack on women's health. Both pieces of legislation are being rushed to the floor this week by the Republican leadership as they ignore urgent calls from the American people for action on a number of pressing public health crises like gun violence and the Zika virus. Speaker Ryan promised a new way of doing business in this House when he became Speaker, but we continue to see more of the same broken promises and failed leadership. During the past several weeks, I've joined my Democratic colleagues in calling upon Speaker Ryan to hold a vote on two common-sense, bipartisan pieces of legislation that are overwhelmingly supported by the American people: the No-Fly, No-Buy bill and legislation to expand and strengthen our background check system. Communities in my home state of Massachusetts and across our country are raising their voices and coming together to demand that Congress do something, not hold more moments of silence, but actually take action. They, at the very least, we can keep guns out of the hands of criminals and suspected terrorists. We have that power to do something about that, and yet the Republican majority continues to sit on their hands and be indifferent in the face of the tragedies that we read about each and every day in this country. Recognizing this call for action, Speaker Ryan announced on June 30 that the House would vote during the coming weeks on a Republican gun-related legislation. But instead of working with both Democrats and Republicans on a bipartisan bill, Speaker Ryan hastily pushed out a toothless NRA written and backed bill that would do nothing to keep Americans safe. But even more frustrating, but sadly not surprising, is the fact that even this bill was too much for some of the hardliners on the Republican side. So instead of answering the call of the American people, eager for Congress to finally act to disarm hate and help to prevent gun violence, Speaker Ryan has canceled any votes on gun safety legislation. It is really a sad situation, Madam Speaker. 1 month after 49 lives were lost in Orlando to an act of hate and senseless gun violence, Speaker Ryan is ready to adjourn the Congress for the rest of the summer, failing to take any action at all to protect the American people and keep guns out of the hands of criminals and suspected terrorists. Americans deserve better from their leaders, and I predict that the American people will not forget this. But look, we shouldn't be surprised. This is just the latest in a string of broken promises and failed action from this Republican majority and its leadership. This week, instead of addressing the pressing issues I previously mentioned, the House will be voting on a very, very weak GMO labeling bill, and yet another piece of legislation that attacks a woman's right to choose. Every American has a fundamental right to know what's in the food that they eat. Plain and simple. I believe they ought to have that right, and that's what today's debate is about. To be clear, today's debate is not about the science behind GMOs. It is also not about whether GMOs are good or bad. Whether you love GMOs or hate them, we should all agree that you ought to know if they are in the food that you're feeding your family and your children. Madam Speaker, the Food and Drug Administration requires labeling of thousands of ingredients, additives, and processes, many of which have nothing to do with safety or nutrition. For example, the FDA requires mandatory labeling of juice when it's from concentrate. It's just one of the ways we tell people what's in their food and how it's made. This piece of legislation would require companies to label their products if they contain GMOs, and I strongly support that sentiment. But this legislation, the way it's written, provides three options for labeling: words on the package, which makes sense; a symbol to be developed by USDA, which makes sense; but then there's this, a so-called quick response or QR code. It was at the behest of big industry that the QR code be listed as an option. Not what's in the interest of the American consumer, but what's in the interest of a few special interests. Now, I would be much more comfortable with a bill that requires either words or a symbol, but a QR code is something that I cannot support, and nobody here should support that. In order to assess the information through the QR code, an individual must have a smartphone and must have access to the Internet. The reality is that not every American has access to a smartphone or the Internet. Look, I don't get reception at a local grocery store here in D.C., just a couple of blocks from where we are here in the U.S. Capitol. It's frustrating. What good would a QR code do if I can't get a data signal using my phone? 1 in 5 Americans in the United States do not have smartphones. That includes 50% of Americans who are low income and living in rural areas, and over 65% of elderly Americans. If we end up going down the route of a QR code, all of these people will be prevented from accessing the information that this bill is supposed to make available to all consumers. And even if someone has a smartphone, they will have to scan every single item they purchase in order to obtain the desired information. And this is assuming that they will have access to the Internet in a grocery store. That's anything but a quick response. It is a bad idea. It is a bad idea. It is an intentional measure to deny consumers information. You know, we considered what we call the Dark Act on this House floor a few months ago. This is the son of the Dark Act. It keeps people in the dark about what's in their food that they are buying. The debate about GMO labeling is about transparency and the right of every American to know what's in the food they eat. It's very simple. The best approach would be a clear and easy to understand label or symbol, not some crazy QR code that only creates more hassle and confusion. From the very beginning of the debate about GMO labeling, some in the food industry have stuck to two main arguments. They have said that GMOs are perfectly safe and that it would cost far too much for them to add a symbol or words to their packaging. But once they came up with the idea to put a large QR code on their packaging that they hope consumers will just simply ignore or not be able to access, they suddenly dropped their complaints about the financial costs of changing their packaging. The truth is that the QR code will take up more space on their packaging than any symbol or simple written label would, and the QR code is going to have to include wording as well. It would be so much easier and better for consumers, for the food industry, to just use wording or a symbol and not this complicated, confusing QR code. And we know that food companies change labels on their products all the time. Jerry Greenfield of Ben & Jerry's ice cream said that it is a normal cost of business to change their packaging. Campbell's Soup has committed to including words on their packaging and has said that in doing this, there will not be an increase in food prices. I want to thank Campbell's as well as Mars and Dannon for all committing to using words on their label and not some kind of confusing QR code. The majority of Americans favored mandatory GMO labels that are clear, straightforward, and easy to understand. Wouldn't it be nice, I know this is a radical idea in this Congress, but wouldn't it be nice if for once this Congress actually did what the American people want? Keeping our constituents in the dark should not be tolerated, and therefore this bill should be soundly defeated by Democrats and Republicans alike. Madam Speaker, we're also considering a totally unrelated bill, H.R. 4828, the so-called Conscience Protection Act, which ironically is yet another unconscionable attempt to take away women's right to health care. Under current law, hospitals and other health care providers can already refuse service to an individual based on the practitioner's own moral objection. But this legislation would take this a step further and actually permit the withholding of medical information about a patient's condition if the physician believes that such information could potentially lead to an abortion. Bosses would be permitted to impose their own religious beliefs across their entire company by withholding abortion services on employer-sponsored health plans. It is not an employer's decision what type of medical care is needed by their employees. Women have the same rights to access to health care as men do, and no boss should be able to deny them that right. This will be the House Republicans' 13th vote to attack women's health care in this Congress alone. 13 times we have gone down a similar road. How can we possibly consider a bill that would allow insurance companies, doctors, or health care facilities to substitute their own religious opinions for actual medical information? Every woman should be able to trust that when they go to their doctor, they are receiving all the facts and information that they need to make their own health decisions. Encouraging doctors to withhold vital information from women about their health is outrageous and incredibly dangerous. Such a reckless bill has no place in Congress. This bill is nothing more than the latest attempt by House Republicans to appeal to their extreme right-wing base. This legislation does not include any exemption in the case of rape, incest, or endangering the life of the woman, and would preempt any state law that does allow for the coverage of abortion. Madam Speaker, we have countless women sharing their stories of how these types of laws have had devastating and tragic effects on them. One woman's water broke at 20 weeks prematurely, and doctors determined that the fetus would not survive birth. The Catholic hospital she was at refused to perform an abortion since the fetus still had a heartbeat. For 7 weeks, this woman had to carry a fetus in her with the knowledge that it had no chance of survival. It wasn't until she was suffering from severe hemorrhaging that a hospital would finally induce labor. The baby died almost immediately after birth, as doctors expected. Another woman's water broke prematurely at 18 weeks. She was rushed to the nearest hospital, which was a Catholic hospital. Doctors knew that the fetus was no longer viable and would die immediately upon birth. However, this information was withheld from the woman. She was simply given 2 Tylenol and sent home unaware that there was no chance that her child would survive birth. The woman returned twice more, each time with severe bleeding, and it was only at the end of the second visit, as they were sending her home, she went into labor and gave birth. The baby died within hours, as the doctors expected. Women's health must always come first, and this only puts more lives at risk. I urge my colleagues on both sides of the aisle not to support it, and I reserve the balance of my time.
The gentleman from Massachusetts reserves.